Hi everyone, it's Nicole from the Physio Crew, helping people rewrite their stories following sports injury and life-changing trauma. On the Ask Nicole question today, we are talking about a chap who had a knee replacement 13 years ago. Now, I don't want all of you guys who are following us to read this and get scared, because this is not all knee replacements are perfect, but a lot of them have really good results. So I don't want you to look at a few little cases and think, oh well, I'm never going to have it done. But it is important, as you will hear me talk all the time, that surgery is a last resort. Now, there's a few things that can affect how we feel pain after surgery, and some of these can be to do with the way that our brain is conditioned. And I'd really encourage you to have a little look over on YouTube, where we've got some educational videos on how and why we feel pain. If you're interested in it, have a little look at the work of Mr. Butler, I can't think of his first name, and Lorimer Moseley. I think it's completely gone. David Butler and Lorimer Moseley. They're really good pain scientists, and they help to explain things really well. So one of the things that I would be looking at is there an element of something called CRPS? So chronic regional pain syndrome is it normally occurs after an innocuous. It can happen after surgery, but it's normally an innocuous sort of injury. So it might be that you tap your hand on a table, or you just knock your foot. Sometimes it can occur if you've had a fracture. And what happens is the brain starts to interpret the signals coming from... Hold on a sec, someone's calling. So they start to respond. The brain is responding in a non-optimal way. So there's a signal going in at the tissue level, which might be saying it's a 1 out of 10 pain. But when it's received at the brain, it's highly sensitized, and the brain output reads it as sort of a 10 out of 10 pain. And that can be the same as thinking about a computer. So if you put in ABC on the keypad, the keyboard of a computer, you expect the computer on the Word document to say ABC. Sometimes the brain doesn't work like that, and the body doesn't work like that. Sometimes ABC will be putting in at the keyboard level, and the computer is saying exclamation mark KTW, and it's giving a poor interpretation. So when we're looking at the brain, what we want to look at is in everyone's brain we have the homunculus, which is a sort of a map of all the different areas of the body. So for example, the nerves of the lips, they're very sensitive, of the hands, so those areas are big within that area of the brain. And what can happen when people are exposed to long pain for long periods of time is those areas of the brain can become a bit fuzzy. What's amazing is, because of neuroplasticity, which is the brain's ability to reprogram, we can actually affect that. Now, a lot of people don't think about that when they're thinking about their pain. They think very much about the anatomy of the actual joint itself. So they think, oh, it must be something wrong with the prosthesis, or it must be something wrong with the muscles, or it must be something wrong with the ligaments. They don't think about the central nervous system. So the central nervous system is your spinal cord and your brain. And of course, without those things, you wouldn't be able to feel pain. So as a physio, how do we look? How would we dissect this for this chap who's had this knee replacement 13 years ago? Number one, we would look at, how did this injury or this pain occur? Did he have to have a knee replacement because he had some kind of trauma? Did he have to have a knee replacement because of osteoarthritis? Did he have pain for a long time previously? Now, if we have pain for a long time previously, there's going to be some element of conditioning. So if you imagine that I get stung by a bee, and that bee stings me on my arm, sensory information comes up to my brain, and my brain gives me a bit of pain, says, okay, stay away from bees in the future. If that bee continued to sting me every single day for 10 years, some people have pain for 10 years before they have a knee replacement. Guess what happens? I start getting very anxious when bees come round me. I start getting a bit anxious when there's something flying, which might be black and yellow. It might be a wasp, and I still might be anxious. And that's because my brain is intelligent. It is there to protect me. And so over time, it starts to recognize this particular stimuli, and it makes us more sensitive to it. So that's all very well, Nicole, I hear you say, but how do we reprogram that? Well, movement is key in reprogramming that, and we can use things like mirror box therapy to help to retrain the brain and its sensitivity. So let's talk about mirror box therapy a second. People who have phantom limb pain, so people who have pain in the limb that's been amputated, will often say, well, how can I get pain in my hand that's not even there? And I often talk about this story of a guy that I helped when I was working in hospital, who had an itch in his big toe, the big toe that wasn't there anymore from his amputation. Now what was incredible is what I did is I put a pillow underneath the sheet so it looked like his foot. His foot wasn't there because it was amputated. I scratched the toe that's not there, it's a pillow, and it relieved his itch. Now that guy isn't nuts. There are lots and lots of studies that show that this can benefit us. One of the other things that I'm really interested in getting in our rehab centre down in Barnstable is some virtual reality, because again they've been shown with people with knee osteoarthritis that often people will feel that their leg looks big or swollen or sometimes even black. This can be a sign of CRPS. And what they found is actually by putting the person into a virtual reality headset and shrinking the knee on the virtual reality can help to reduce pain. How nuts is that? That is incredible. But how exciting for people who think, well, actually, I've had this pain for ages. There's nothing that's worked. I've been for physio, I've been to the doctors, I've tried medication, but there are new things coming out that we have to really consider. And that's why seeing a physio who is holistic and specialist and looks at things from lots of different angles is really, really important. So often with the management now, it's, especially in the UK, it's this kind of, well, we send you to physio within the NHS, which maybe is 4 sessions, which in my opinion is not enough to truly understand somebody and get them on board and actually committed to what they need to do. And then we give them drugs. Well, these drugs, these opioids, we know that they increase your sensitivity to pain long term. So are we failing patients? I believe that we are. So for this particular chap, do not give up hope. Just because it's been 13 years and you've had pain, I would be looking at exploring different avenues. So you might be finding that it's too painful to walk. So look for an anti-gravity treadmill near to you. What an anti-gravity treadmill does is it lifts you up a little bit so you're able to walk with less weight. Quite often what we do with people is we get them walking just on a tiny bit of weight to begin with. Their muscles adapt to that load, they get stronger, and that means when they progress, they have less pain. We also look at really thinking about the sports physio aspect of it. One of the things with working with Bristol Ladies, I looked after 12 international players. What was amazing about that is suddenly, when I was going back into clinic, it didn't matter to me whether the person was 87. I was still using these techniques that I'd learned on elite athletes. So I was getting them moving, I was doing soft tissue work, real hands-on soft tissue work, helping them to get that buy-in, and looking at the psychological aspect as well. Are they not able to do the things that they love? Do they lack confidence in being able to really achieve their goals, and helping to dissect that? Number 2 is I would look at, are you on massive pain relief? And if you are on high level pain relief, don't panic. No one's going to pull that away from you. People get really anxious, it's going to get pulled away. But look at different options. Could you be using a TENS machine instead to help? Could you speak to your doctor to see whether they could move you off opiates, which will in the long run increase your sensitivity to pain? Because if they're not working, why take them? Lots of people, I don't want you coming off your meds really quickly. You need to talk to your doctor about it. But you know, we have to really challenge our belief systems here. People say, well, I take all these medications, they don't work. Well, don't take them then, because they have massive, massive side effects and consequences. You know, sometimes pain, it's not always the most comfortable thing to do, but sometimes actually we can manage things by doing a few exercises every day. And people say, oh, well, I don't have time to do that, or I forget to do that. Those are all modifiable things that you can change. You have to make time. If your knee is that bad, you have to make time. And sometimes you just need an expert to help you to understand how you can do that without being too uncomfortable. One of the things that I would suggest is if you have knee arthritis and you have a lot of pain, get into a hydro pool. I know that's really difficult at the moment, and because of COVID, and I know COVID is going to have a lot of secondary complications, consequences, to people because they haven't been able to exercise normally. But get into a hydro pool with an expert. Try and get moving, get that warmth of the water. It's not the same being in a swimming pool. People always say to me, oh yeah, just go swimming. It is not the same. It needs to be heated. It needs to be 34 degrees. If not more, and then you can use woggles, you can do loads and loads of different things to really achieve the result that you want. So to the person who was asking about the 13 years and still got pain, do not give up. Try different options, and if you need any advice, you can always book a discovery call with us. and make sure you're following us across Instagram. Facebook will show you the lives, but it's not very good at showing things unless you're actually on the page. So go over to Instagram, check out what we're doing there, and we've got some YouTube videos too. I hope you guys have an amazing day. I'll have a little look. I'll try and do 2 more Ask Nicole questions. I am on training today. I must be the only person who does training walking around a field. They all laughed at me actually because I was on the video. Anyway, have an amazing day, guys. Speak to you soon. Bye now.